I often joke that I've completely Forrest Gumped my way through life. My path was a very circuitous one. I had no intention of ever being a doctor. I went to work in the music business for 5 years at a record label, a big famous record label called Atlantic Records. And then I left and didn't know what I wanted to do with my life. And I thought, what is the biggest, craziest thing I can do? And it was become a doctor.
Hi, this is Dr. Katie Patel, and this is your Integrative Medicine Colleague Consult.
Good morning, Gary. Thank you so much for taking the time to chat with me this morning. Could you introduce yourself to the audience?
I'm Dr. Gary Soffer. I'm a pediatric allergist and immunologist. I'm an integrative medicine physician, and I'm also associate program director of the pediatric residency program here at the Yale School of Medicine.
What do you think integrative medicine teaches that you would want every doctor to know?
Ultimately, integrative medicine is just good medicine. It's really using the best of what kept people healthy for thousands of years and integrating in what makes people well now. So for some people, it's diet and exercise, and other people, it's yoga and meditation. But try to think about a different lens, right? Try to think about how you see medicine instead of how it may be presented to you. So instead of thinking about pathology and what something might look under a microscope, think about how that patient is experiencing their disease, what they're going through in that moment, and how do you make them feel well?
Feel like I've heard a lot more interest in integrative medicine in this generation of medical students. Why do you think that there is more talk about integrative medicine?
I think part of it is building an integrative medicine field that is more evidence informed. But also part of it is just seeing so many more patients with chronic diseases. If I was in a car accident, I'd want to go to a very modern emergency room. But if I have chronic pain or if I'm dealing with an autoimmune disease, there's a lot that integrative medicine offers that's much less invasive.
So, what would you say is a great resource for a medical student who's interested in integrative medicine?
Andrew Weil's group put out a pediatric integrative medicine textbook. There's another great textbook on integrative pediatrics by Hilary McClafferty, and another one by a legend in the field, Kathy Kemper. And then people can always email me. It's a small, integrative pediatrics world. It's a small integrative medicine world. And I'm always happy to talk about it and help people through it.
What do you think a medical student could do on their clerkship to stand out and impress you?
The more engaged you are and the more patient forward you are. And the things that impress me most are when you really come with an open mind, show a sense of humility and a sense of curiosity, a sense of excitement, and not at the cost of anybody around you.
What do you think a medical student rotating on clerkship with you should avoid doing? What would make them stand out in a negative way?
I think the biggest mistake that medical students often make is trying to be a gunner or trying to impress somebody, doing things at the cost of those around them.
What do you think is the best piece of advice that you received during your training?
It's all about service to the patient. I'll tell a story. As a surgeon I was working with, there was a patient who needed an appendectomy, but she was waiting, and he went through everything with her, discussed the procedure, discussed the process and everything that was going on, and said, "Do you have any questions for me?" And she looks at him. She had a very southern accent, and she looks at him and he goes, "Sir, do you know where I can get a hairbrush?" And he sort of giggled and said, I don't, but let me try to figure it out. And I followed him downstairs to his locker where he pulled out his own comb, washed it with alcohol, soap, and water, and brought it up to her because that's what she needed in that moment. I would just tell you that my greatest, quote, failures turned into my greatest successes.
Hmm.
I had initially intended to be a surgeon and I didn't match. And that was traumatic for me. I had spent 4 years trying to accomplish this goal and working really hard, and then all of a sudden the goal was not accomplished.
Mhm.
That year led me to 3 months in India, a month at University of Arizona doing integrative medicine rotation, which was transformative, and then deciding to go into pediatrics instead, which has made me an infinitely happier human being than I think I would have been.
Gary, thank you so much for taking the time to speak with me. I know our medical students will be so appreciative of your insight, and I really appreciate it.